The number of patients presenting with diabetes following the pandemic is high, but the solutions are ever evolving. Cromwell Hospital in London is leading the way when it comes to offering innovative yet non-invasive treatments for patients living with diabetes or weight management conditions. We went to find out more.
Almost 1 in 10 people in the UK will have diabetes by 2030, with obesity fueling a rise in cases, leading to devastating complications, including heart attacks, kidney failure, stroke, amputation and blindness. 90% of type 2 diabetes patients are overweight. Mr. Ahmed Ahmed is a world-leading expert in bariatric surgery and weight management at Cromwell Hospital in London. And this little inflatable capsule is helping him to tackle obesity and type 2 diabetes.
So what this device does is it basically, once it's in place in the stomach, stops people from eating a lot of calories. So it cuts down their food intake. And this in turn causes a degree of weight loss, which in turn helps improve and sometimes even cures their diabetes.
So how does it work?
So this is the swallowable balloon. Most people will swallow this no problems with just a glass of water. Once it reaches the stomach, we will do an X-ray to make sure it's in the right spot. There's a little catheter coming out of their mouth, and then at the end of this we connect to a bag of fluid. That fluid that then gets released through the catheter goes into the capsule, which then opens up as this balloon. So the balloon, as you can see, will be in the stomach, occupies about a third of the space in the stomach. And this is what provides reduction in hunger and also a prolonged fullness after meals.
The balloon is extremely tough, as demonstrated with the heel of my boot.
What's really interesting is that in 4 months' time, there's a little valve in the balloon which opens up, the fluid slowly leaks out, and then the shell of the balloon makes its way out through a normal bowel movement.
Patients come to Cromwell Hospital for the treatment. It's non-invasive and takes just 15 minutes. They're then put on a 6-month lifestyle programme, receiving support from a team of specialists at the hospital, including specialist dietitians. They're also given biometric weighing scales and an activity watch that link to an app to help keep their weight loss on track.
Every time they weigh in, that weight gets sent to both myself and my dietitian. So we have active monitoring of weight loss during this journey. So the patients feel empowered. They know that we are there with them during this journey, watching their weight loss.
And the swallowable balloon, this has had a huge impact on your patients?
We know that lifestyle changes in the best treatments and studies cause about 5% weight loss. What you can achieve with the balloon is around 10 to 15% weight loss.
A study by the makers of the device found patients' blood glucose levels, HbA1c, fell from around 7, which is in the diabetic range, right down to 5.5, which is in the non-diabetic range. People travel from all over the world to be treated by Ahmed, who also works in the NHS.
For me, what gives me the most satisfaction in my job is to see somebody who's a diabetic on tablets or even injections, and then to see them 3 or 6 months down the line not needing any of these treatments, and also seeing how their life and their quality of life has improved significantly from treatments.